What's up, beautiful people? Another day, another study. We've talked a lot about dementia, risk factors. We even talked about air pollution before, and the Lancet study looked at the 14 modifiable risk factors. Now, what's interesting is the gold standard currently for diagnosing Alzheimer's and other types of dementia is autopsy. We have cognitive testing. We now have some blood markers that we can look at, and the diagnosis is often clinical, but still the gold standard is autopsy. And we know that PM 2.5 in studies is associated with increased dementia risk. It's also associated with increased cardiovascular risk. And therefore, it's unknown if the increased risk in dementia is due to, or in part due to, the increase in cardiovascular risk, but there also might be some direct associations like an increase in oxidative stress. And we see that there is brain volume loss. So this study was looking at autopsy for PM 2.5, a type of air pollution that we monitor, and they're looking at neurodegenerative pathology, Alzheimer's pathology, and other things. And so depending on the specific pathologies associated with Alzheimer's, there was between a 17 and 20% increase in adverse neuropathology for increased PM 2.5 exposure. There was also an increase in risk of large infarct, so large stroke, about a 16% increased risk per one increase in PM 2.5. And then in the longitudinal model, where people got multiple cognitive tests over time, increasing levels of PM 2.5 were associated with faster rate of cognitive decline. Another thing that's interesting was in the sensitivity analysis, it was independent of ApoE status. We've talked a lot about ApoE. It's a genetic marker that's associated with increased risk of Alzheimer's dementia. It's something that I have. So overall, this is adding to the body of literature showing that air pollution, PM 2.5, is associated with Alzheimer's disease and neurodegeneration. I personally have air filters in the house. We live in Houston. Air quality is not the best. I actually posted the story of our air quality today previously. So it is something that I monitor. It is something that I educate patients about. And I'm hoping it's something that the government takes a bigger interest in, because we're continuously seeing more and more studies about the forms of air pollution and PM 2.5.